Good evening, welcome to Left, Right and Centre. I'm Vishnu Shom. On the program tonight, as India hits 75 crore vaccinations, we are joined by Dr. VK Paul, head of the National COVID Vaccine Task Force. The job ahead remains daunting, but has the short supply of vaccines finally been resolved? Are we now ahead of the curve in defeating COVID in India? Also on the show tonight, the tragedy that is unfolding in Uttar Pradesh, part of which our crew witnessed today. Over 100 people have died of dengue in Uttar Pradesh, 60 of them in Firozabad alone, where over 16 children have died in 24 hours, as desperate parents beg and plead for hospital beds, carrying sick children on their shoulders for miles only to be turned away by hospitals. How can the Adityanath government still be napping? But the big focus on this program this evening, the status of vaccination in the country, India's battle against COVID. Dr. VK Paul with us, sir. It's a good time for us. 75 crore vaccinations have been done. That is a world record. We are ahead of the curve now in terms of the physical number of people who've been vaccinated once, if not twice. But the big question is this: what % of our eligible population will be vaccinated by the end of December, which was a target of the government?
Thank you, Vishnu. Yes, indeed, today is a landmark day in our journey to push back the pandemic through the vaccination approach, which is our most effective shield. And 70 crore doses having been administered in a vast nation, complexities of implementation is truly remarkable. It's a tribute to the 75th year of independence. स्वतंत्रता का अमृत महोत्सव के लिए एक tribute है ये. And it shows the resolve and the capability of the people of India and the state and union government together to stamp out pandemic in shortest possible period of time. Yes, indeed, you rightly noted that the supply situation is increasingly better. Capability to vaccinate large number of people is increasing. In month of May, for example, we were vaccinating on a daily basis on an average of 20 lakh individuals.
Right.
Today, it's well stable at 75 lakh and even more, 78 at times, varying from week to week.
But
so
Dr.
it shows
Paul,
the capability.
Sure.
And yes.
Dr. Paul, if that's great news for us because, time is of essence. But let's just have this graphic up full screen, and what you actually see is the green bar. That green bar is where we are in terms of vaccinating right now. There's definitely been an uptick, but the red bar on top is where we need to be. And the fact of the matter is, if we are looking at the December target, we are still short. So therefore, Dr. Paul, the question is this: how many more months will it be before we get that eligible population fully vaccinated with 2 doses? It's unlikely to be December at this rate.
Vishnu, yes, we have watched the space because the acceleration that you are now experiencing is unique, and with increasing availability of the vaccine and its spread and efficiency in implementation of the vaccine, these graphs may look very different as the time pans out. So have faith.
That's great news.
The resolve.
Do you believe, therefore, by December you will meet that target?
Well, we have said that we will work extremely hard to achieve that target. And I think in terms of the supplies, things are happening. In terms of acceleration of the expansion of the program is also happening. So watch the space. We need cooperation of all the people to make sure that we do not experience vaccine hesitancy going forward. The last mile walk is as fast as the walk that we are now experiencing and accelerating. Yes, there are challenges, but let's work with that resolve and that hope and that aspiration and that goal as a nation. Yes, it is possible. It is possible.
So just broadly, it is possible, all right? So it is possible by the end of December to have all eligible individuals in this country, and I'm not talking yet about children, but all eligible adults to be vaccinated by the 31st of December?
Well, we are working in that direction, and there's nothing hidden in terms of the speed, in terms of the capability. And we will continue to push the envelope, yes.
Okay. So the question which, everybody is asking, you'd be asked this many times a day perhaps, how much longer will we need to wear masks?
Well, Vishnu, the wearing of mask is a different question, because we have known now quite clearly that irrespective of the vaccine, the type of the vaccine or the nation, what we now know is the entire cohort of vaccines that are available across the globe are, as has been stated, as not disease preventive but disease modifying. And we have seen this in no other nation than the US, where you experienced a huge wave, which is still ongoing in some sense, due to the Delta variant, which increased the cases like crazy.
Yep.
But remember, the deaths have been phenomenally low. And this is the experience that you see from other countries. So there is the shield of a single dose of the vaccines that we have and the other people have is, effective in terms of reducing mortality well above 90%. And that's great, because ultimately the pandemic toll, the biggest indicator of how much toll the pandemic has taken, is deaths. And of course, yes, the 2 doses are, the full course is even more effective.
So we will need to keep wearing
Yes, we'll
our
have
masks,
to continue to
well
wear
into the
masks
next
for
year?
some more time, surely, and this is quite evident from the experience around the globe. And I would urge that let's not experiment with that. Let's just accept it that that is needed, and please create an environment that we wear the mask even more cogently, effectively, and expandedly in the course of the festivals that we will be experiencing in the next few weeks and months. And so wearing the mask will not go away clearly for some time. We are also hoping that there will be some breakthrough in terms of medicines that treat early infection so that it does not deteriorate. And I think that journey is very important, Vishnu. We have been lucky with the vaccines, one after the other across the globe, but we want to be as lucky for effective new medicines which stall the progression of the disease should an individual have the disease. My view is that it will be a combination of vaccine and drug and a reasonable disciplined behavior that will finally see us through.
We need to be wearing the mask well into the next year. Let's be honest, that is the case, right?
It looks like, yes, that we will continue to wear the mask even through the next year, at least the early part.
All right. Is it correct, therefore, to say that COVID is now endemic? It will always remain because it will mutate. Now, every mutation is not necessarily deadly in that sense. But have we as a world, as a globe, not India, failed in eradicating COVID?
Vishnu, the aspiration of the humanity is to eradicate all such scourges, including this pandemic. That's a goal toward which the entire world community would be working toward. But the way the scenes are appearing is that there could be multiple scenarios. So this pandemic may peter out just like the SARS pandemic or outbreak that happened. It is also conceivable that it will come down to a low level, and then it stays as an endemic disease, and we keep tackling it with vaccine, with mask, and or hopefully some drug in near future. And it stays there, we live with it, and the life goes on. And a new normal is not too far from the real normal, hopefully. Okay. But there's another scenario that the pandemic may go on for some more time at a low level, and then periodically, with the mutation, there could be pandemics within pandemic, so to say. So I think how it will pan out is still conjectural. It's evolving science. It's part of that huge unknown that we really do not know as yet. But the point is, current tools have to be used effectively to bring down the pandemic and replication of the virus to the minimum, because that is some kind of a guarantee for us to move toward normal, but more importantly also, hopefully, with less replication, hopefully the variants may also not be too tricky. Okay. But it is still, we are still at crossroads. We are still in uncertain times, and we have to be not lowering the guard at all.
Got it.
Going forward and effectively embrace vaccine, but also embrace the other tools such as COVID appropriately.
Dr. Paul, has India entirely overcome the shortage of vaccines? As I understand it, Covishield is being distributed in numbers which work for us. But Covaxin, you were trying to step up manufacture. Has that matched your expectations?
Vishnu, you have to look at the overall picture. You may recall that we presented data on the expected production that the industry was aspiring for. And there were vaccines in different stages of development, some outright production, some behind it. The entire industry is making effort to stick to those guidelines and stick to those aspirations. And in fact, for Covishield, in fact, it rose well above the expectation. Also, the good things happened. Where we thought they will not go above 13 to 15 crore per month, we are so happy to say that they are now consistently going to be above 20 crore or more. So also the positives happened. Yes, there was some setback for Covaxin. Nobody could have foreseen. These are new entity, new industrial systems. It happened, but I think we have overcome now, and their supplies are also picking up. Their Bangalore facility is doing very well. And yes, indeed, there is an improvement from their side also, and we should be proud for that. It's a small company, new vaccine, entire vaccine, which is through their own effort. And so setbacks can happen, but the aspiration is evident. And also, look at the overall picture, Vishnu, today. You have BioE vaccine moving pretty much well in that direction. You have the mRNA vaccine moving pretty much toward production. And also the other vaccine, the nasal vaccine, and ZyCoV-D vaccine, the DNA vaccine. So we are moving quite consistently in the direction of a larger bouquet of vaccines. More platforms mean more security going forward. Right. Should we fail by one platform? And also increasing stockpile by the day. So indeed, we have entered a new phase of optimism, greater production and greater delivery, and that I think every Indian should celebrate.
Okay, so Dr. Paul, next question. When will vaccines for children be rolled out in sizable numbers? I know about the work done on ZyCoV and children. It's been cleared for use 12 years and above. But we aren't talking enough about this in this country. We need to be talking about the importance of vaccinating school-going children. Why aren't we talking enough about this, sir? The rollout, the numbers. Why do we keep talking about, shortfall of Covaxin, sometimes Covishield, but why are we not at a stage when we are already inoculating kids?
I think, Vishnu, the narrative on childhood vaccine should be fine-tuned and rational and not hyped. Please appreciate that the childhood vaccine is being applied only a few nations. They have, taken care of their adult population. They are in a position to extend it downwards. But there is no WHO recommendation for vaccinating large-scale vaccination for children. So please, let's appreciate that to open schools, for example, you do not need to vaccinate children as a precondition. It is not a precondition. Also,
no, I'm not suggesting it is.
No,
I'm not suggesting it is. But we still need to vaccinate children.
No, but this comes up. So it should. I think the media should help, bring the narrative to a balanced future discourse or future decision making. No vaccine below 12 years is applicable in principle, and a lot of children are below this age group. Now, on the availability of the vaccine for children, the situation is absolutely clear. We have ZyCoV-D, which has relatively limited availability profile going forward. So about 1 crore per month or little more than 1 crore per month per dose. This is the visibility that we have. So we will do the best use of this vaccine. And if our National Technical Agency advisory group says give it for children as a priority because that is the best use, we will take that decision. Then Covaxin trials in children are near completion and near results. Let's wait for that vaccine to be shown to be effective and safe. Safety is very important. Once that vaccine becomes available, we can consider whether to extend the vaccination to, let's say, children above 15 years of age. It's a stepwise process. It's evolving science, and the decision will be based on science and overall the best use of the available vaccine.
Okay. So, sir, my next question.
But we also know, Vishnu, that the disease is mild, minimal. By and large, only children with comorbidities have an issue. And we have seen in other countries that even though a little proportion of children in the pandemic as a proportion of total cases may go up, the mortality actually has become lower. because overall toning up of the system, and that's the scenario that's emerging.
No,
so
but
no
sir,
need for panic.
are you convinced about the safety of these vaccines for children before rolling them out, or is there still some time left in the process before you say that no, please go ahead, roll them out?
Well, you have seen that we have a emergency use authorization for the DNA vaccine, and it has been seen and by the scientific groups, and to the extent that the trials are available, it shows safety and therefore released for use in potential use for children. Done. For Covaxin, wait for the results of the trial, look at the immunogenicity, we go on. We have some idea about mRNA vaccines made elsewhere to be effective. Long-term safety cannot be assured for even in adults, as you know, because the total experience with this vaccine is about less than 1 year, as you know, in real lifetime. And therefore, we go with the premise that the trials demonstrate safety, and that's good enough for us to take decisions. But as we move forward, be watchful.
Sir,
and use other tools to prevent the disease.
Sure, sir. One more quick question. When will Covaxin get a World Health Organization clearance? I get students write emails to me every day saying that we've had 2 shots of Covaxin, I cannot study in Canada. I've had 2 shots of Covaxin, I'm now being told that doesn't count, I have to get another vaccine when I go to study somewhere or wherever it is, and there is no science which says I should be mixing Covaxin with Pfizer. These are very real issues.
We expect the WHO's decision, and we hope it will be positive, we are reasonably certain, before the end of the month.
Okay, hopefully there'll be a decision, a positive one by the end of the month. Let's see where that goes. Final question to you, sir. Has India staved off a 3rd wave for the moment?
Vishnu, we are still in the course of declining phase, or the plateaued phase of 2nd wave, should not forget that. Number of cases, although confined to certain geographies, should continue to have a concern in the minds of all of us. And that should not be forgotten. Guard cannot be lowered. The issue about emerging outbreak, watch it carefully. It cannot be ruled out. There is a period of the next 3-4 months when the vaccine is rolling up to build the great wall of herd immunity. We need to protect ourselves and avoid the outbreak. To me, that is possible if we are all together in this.
Sure.
And I think the media's narrative should really go in that direction to prepare us to use the remaining other tools for self-protection with face mask and social distancing, avoiding crowds, not going unnecessarily into the market, into the shop complexes and other crowded places, and travel for these few more months. Let's have celebrations this time which are subdued within the family.
Do you want restrictions during the celebrations?
Very important.
Dr. Paul, do you want restrictions? Government, I don't know if it's even possible in our country, given the way the manner in which we celebrate. But do you want some restrictions during the Dussehra and Diwali?
We are in the phase of, we are going through the pandemic. We have a risky period coming forward. There are ways to ward off the virus in such a situation, and there are guidelines that are available to invoke restrictions in a graded manner, and they should be invoked when the time comes. It is a timely intervention on the part of the administration and the people, above all, which can and should and will avoid any significant outbreak going forward.
All right, Dr. Paul, lots of questions there. Thank you very much. It is a landmark for us to have crossed 70 crore doses of the vaccine. We need to keep this up. We need to save lives. Thank you very much, sir, for being with us. Well, we're moving on today to another health concern. Over 100 people have become victims of dengue in UP. In Firozabad alone, over 60 lives have been claimed by dengue in the last 24 hours. Over 16 people have died. In fact, we've seen children die in front of us as well. Joining us now, IP Singh, National Spokesperson of the Samajwadi Party, Sunil Bharala, Chairperson of the Labour Welfare Council, Government of Uttar Pradesh, also a senior leader, and Dr. Ved Prakash joins us, Head of the Department of Pulmonary Critical Care at King George's Medical University. सुनील भराला जी, ये फिरोजाबाद में जो रिपोर्ट्स अब आ रहे और ये नंबर्स जो है 100 से ज्यादा लोग डेंगू से मारे गए हैं उत्तर प्रदेश में, 60 लोग कम से कम फिरोजाबाद में, 16 बच्चे मर चुके 24 घंटे में, तो हो क्या रहा है फिरोजाबाद में? भराला जी, सुनाई दे रहा है आपको?
हाँ, आया, मुझे आवाज आई है आपकी
जी बताइए। मैं आपको फिरोजाबाद के बारे में पूछ रहा था। 16 बच्चे 24 घंटे के अंदर मारे गए हैं। 100 लोग डेंगू के कारण यूपी में मारे गए हैं। 60 लोग फिरोजाबाद में ही। तो हो क्या रहा है?
देखिए विष्णु जी, ये बीमारी हर वर्ष आती है और ये मलेरिया, डेंगू, वायरल फीवर, ऐसी कई सारी चीजें आती हैं और उसका हम डट करके फिर मुकाबला करते हैं। और हमारे चिकित्सक, हमारे जिला अस्पताल, हमारे आयुर्वेदिक डॉक्टर जितने भी है, सब वो अपने उस पर लगे हुए हैं।
सुनील जी, आप देखिए, ये मैं आयुर्वेदा वर्सेस एलोपैथ, ये इसके बारे में नहीं पूछ रहा। मैं सिर्फ हमारे संवाददाता के सामने 3 बच्चे मारे गए आज। वहां कई बच्चे, उनके पेरेंट्स वहां बाहर है, कह रहे कि अस्पताल के अंदर बच्चे को ला ही नहीं सकते, जगह ही नहीं है, इंफ्रास्ट्रक्चर ही नहीं है। तो इस स्थिति में पेरेंट्स करेंगे क्या, बच्चे करेंगे क्या?
देखिए ऐसा है कि ये कहना तो मुझे लगता है कि नाइंसाफी सी बात कह रहे हैं कि स्ट्रक्चर नहीं है और वहाँ व्यवस्था नहीं है। अभी कोरोना काल को लेकर के हम सब लोगों की तैयारी है, तीसरी लहर की भी हमने तैयारी की है और व्यवस्थाएं बनी हुई है। हाँ, ऐसा हो सकता है कि जो बच्चा कोई पीड़ित था या बीमार था जी, उसको वर्तमान की चिकित्सा ना मिल पाई हो, या कोई ऐसा हो सकता है कि कोई इंजेक्शन ऐसा हो कि जो शॉर्ट हो या वहां ना हो, डॉक्टर ने क्या इंजेक्शन लिखा है वो तो मैं मान सकता हूं। लेकिन ऐसा नहीं कि स्ट्रक्चर नहीं है, बेड नहीं है, ऐसी बात कहना तो बिल्कुल नहीं जमती है। क्योंकि अब तो इतनी भारी व्यवस्था है, अगर तीसरी लहर भी आ जाएगी, मलेरिया, डेंगू हर वर्ष की भांति बीमारी
हर वर्ष होता है और हर वर्ष हम यही सवाल पूछते रहते हैं। आईपी सिंह जी, हाउ डू यू रिएक्ट टू दिस पर्टिकुलर सिचुएशन इन फिरोजाबाद?
Similar language used by सिद्धार्थनाथ सिंह, और वो मुख्यमंत्री के कॉन्स्टिट्यूएंसी में जब इंसेफ्लाइटिस से 500 से ज्यादा बच्चों की मौत गोरखपुर के क्षेत्र में हो गई, तो सिमिलर इसी तरह का बयान उन्होंने दिया था। आप सबने देखा कि लाखों लोग उत्तर प्रदेश में कोरोना से मारे गए। आज जो हालात हैं, सिर्फ विष्णु जी, ये हालात सिर्फ फिरोजाबाद, मथुरा और सिर्फ आसपास के इलाकों में नहीं, बल्कि मैं आज आजमगढ़ से लाइव कर रहा हूं, मेरा नेटिव प्लेस है। पूरे उत्तर प्रदेश में, पूर्वांचल में इंसेफ्लाइटिस के साथ जो ये बुखार है, इससे मौतें हो रही हैं। जिस तरह से मां की गोद में बच्चे तड़प तड़प कर मर जा रहे हैं, दिल बैठ जाता है देखकर। और ये सरकार सिर्फ विज्ञापनों से चलती है। विज्ञापनों में देखा जाए तो सब कुछ नजर आता है। कोविड के दौरान 50 लाख से ज्यादा लोग मारे गए। मेरे अपने परिवार में 4 से ज्यादा मौतें हुई हैं।
जी, आईपी सिंह जी, दिस इज वेरी सैड टू हियर दोज डेथ्स, बट आई वांट टू गेट अ मेडिकल पर्सपेक्टिव. डॉक्टर वेद प्रकाश, why is this a basic issue of infrastructure missing in this hospital?
Yeah, Vishnu, this is very much valid question about the infrastructure, and I will I will also throw some light on the holistic issue, as we cannot solve this issue permanently with the patchwork. It required a meticulous and visionary planning of the cities, and what we are doing the patchwork, we are taking the measures and then we forget the issue. But what we need, we all know that this season is known for the vector borne diseases, and we have the calendar, so we have to prepare in advance rather.
No, I know, and it is absolutely tragic that we should be seeing this situation right now. We've got a couple of questions which our viewers have posed to us. This question: what are the precautions that the government took to control dengue? This is a time-tested question. We're running short on time on this program, but I must bring you up poll. The situation in Firozabad and dengue deaths: is the UP government still napping? 27% say yes, in fact the government is napping. No say 73%. How then do you actually account for the situation as it is on the ground. We're completely out of time on this program. Time for this short break. More coming up.